Hello, my name is Nicholas Scalercio. Here's my flashcard I'm going to be using. Today we're going to be talking about the integumentary system. Now, the integumentary system, or integument, consists of the hair, skin, glands, and nails. The integumentary system is the largest organ system of the human body, and it covers the entire surface of the human body, including the anterior of the eyes and the tympanic membranes, or your eardrums. The integument turns inward at the lips, the nostrils, the anus, urethra, and vaginal openings, where it seamlessly transitions into the mucous membranes. Integumentary system contains four primary types of tissues, with the first being the epithelium. Next is the base connective tissue, followed by smooth muscle tissue, and lastly, nervous tissue. The epidermis is the top, most superficial portions of your skin. It's the part that you can see. It's part of the epidermis. It's split up into 5 layers, with the deepest bottom layer first, called the stratum basale, followed by the stratum spinosum. Next is the stratum granulosum. Then you have the stratum lucidium. And then lastly, the top superficial portion is the stratum corneum. Now, the stratum lucidium is the thick skin that you find on the palms of your hands and the soles of your feet. The dermis is the lower portion of skin underneath the epidermis. The dermis is the connective tissue, and it's split up into 2 layers. Now, the first layer, most superficial of the dermis, is called the papillary layer. It's made up of loose connective tissue. Underneath the papillary layer is the reticular layer. It's made up of tightly woven, dense, irregular connective tissue. And that portion of the dermis contains all of the blood vessels, the sweat glands, the sebaceous glands, the hair roots, nerve endings, and other micro organs. Underneath the epidermis and the dermis is the hypodermis. It's the lowest portion of skin, most deep. It separates the superficial portions from the deep fascia, the bones, and the muscles. The hypodermis also contains the adipose tissue, which is the fat tissue. A clinical example that's important for someone going into my setting of physical therapy, being a physical therapist assistant already, working in a rehab hospital, I work with a lot of geriatric patients, people who are older. An important anatomy to remember about the skin is how with age, increased advanced age, the skin degrades due to decrease in elasticity and collagen, which leads to a very thin skin, literally. Now, that thin skin is very susceptible to abrasions and cuts and scrapes. I've had patients, get skin tears just by trying to get out of bed and, rubbing it on the sheet the wrong way, and it makes a little cut. Now, those cuts, are very susceptible to infection and pathogens, so it's important for someone in my field to remember that the older population is a little bit delicate when it comes to their skin. You need to be careful in order to keep your patients safe and healthy. And that concludes my speech. Thank you.